how has COVID impacted your job and the ones around you? What have you kind of seen through this process?
Sure. COVID has definitely taken, not even, it's definitely taken a very big operational toll on the organization. So when we don't have the bodies to be able to fill the seats, then it impacts us in a large way. In the last year and a half, we had spikes where we had, a large part of the workforce that were impacted at any given time. The only way we were able to really get through that was by working with labor, by working with the union in order to relax some working rules that we had. And then also counting on the fact that all our employees were coming in and working overtime shifts, working extra duty in order to fill those vacancies that were created by people that were off sick. Mentally, I think just as COVID has taken a toll on everyone, for our folks, it really is that kind of threat where they're interacting directly with all these people in the nursing home facilities and the people that are the sickest, and helping transport them or get them transported to the hospital, and then knowing that that they're being exposed daily, and then taking that home to their families and potentially giving them spreading the infection. So it adds a stressor on everybody's kind of daily operation, and in the way that we kind of have to make sure that we're constantly maintaining that vigilance to make sure that we're not only not spreading it within the organization, but definitely not taking it home, but making sure that we're giving the proper treatment and care to those people out there that are asking for our assistance.
Sure. That makes sense. So, what is during your time as the fire chief, what is the most important decisions you've made as a leader in the community? Is there a moment that stands out to you of something that really impacted you in your role?
So community-wide, we've definitely had instances of natural disaster. We've had instances of civil unrest. We've had things like that where we've had to make very quick and rapid decisions to be able to expand the command structure for those incidents and into what we call the Emergency Operations Center. So we typically here at the fire department are the trigger for that, for planning for the event, for making sure that we're prepared, and then ultimately organizing the city-wide resources that are necessary to respond to that event, and then ultimately working with City Hall in order to make sure that we're communicating effectively with everybody, and bringing together that command structure that ultimately gets us through those events. So that's one area that we have made significant impacts. But also I would throw into that something we did right at the beginning of COVID, and that was the establishment of the homeless outreach team. And that team was thrown together in order to help educate, provide some assistance to the homeless population and to the shelter operations during the height of COVID, to make sure that that we could assist them in making sure that those people were being looked after, protected, and also taken care of. Because as COVID progressed, the homeless population, they were cycling in and out of the emergency rooms many times with positive test cases, and then just circulating in population. And we needed to get them the same ability that people had at home to quarantine. We had to provide that for them. So we create quarantine shelters. We had to do all that kind of stuff. The homeless outreach team helped us to do that. That has since progressed into a team that now is made up of 14 individuals. And so we have 3 firefighters that are assigned, 3 police officers, but we've also contracted with a social service agency called Network 180 to provide social workers, to provide substance abuse recovery coaches, mental health recovery coaches. And that team together works to interact daily among the homeless population, the unsheltered population out in the community. And so that's been a very successful program, and one that we're proud of, that we were able to have a large hand in kind of implement.